This segment of DelmarvaLife is brought to you by TidalHealth.
You're watching DelmarvaLife, and the fight against cancer, as we all know, is a fierce one. And the team at TidalHealth is relentless, though, in their will to win. We are here today at the Richard A. Henson Cancer Institute in Salisbury, and I'm joined by the medical director of the institute, Dr. John Mansuetti. You're also, of course, a radiation oncologist. And I'm excited to kind of learn more about how you guys are fighting the good fight here. So a lot of the way you do what you do is through state-of-the-art technology, right?
Correct, yeah. And that's the thing, in my specialty, radiation oncology, the technology is constantly, it's so rapidly expanding and changing. And the great thing about the Richard A. Henson Cancer Institute is we are constantly staying up on the latest and greatest. And so we've been the organization's been very supportive of providing us with the best technology. So we have the Variant TrueBeam. It's the best linear accelerator out there to provide radiation therapy. We have the Perfect Pitch couch, which is a 6-degree freedom couch. We're the only ones on the Eastern Shore that has it, that basically can position the patient within sub-millimeter accuracy, which is so important for some of the high-tech treatments that we're doing right now, like stereotactic treatment to the brain or stereotactic body radiation therapy to the body, to be able to give extremely high dose of radiation therapy to the tumor, but minimize any dose to your normal structure. So I can treat a tumor like right by your optic nerve and kill the tumor, but not harm your vision. I mean, it's just incredible technology that we have.
And you mentioned stereotactic body radiation therapy. Can you tell us a little bit more about that?
Sure. A very common thing would be like an early stage lung cancer, where a patient has a small tumor, it doesn't look like it's spread anywhere. And so what we can do is we can do a very, very high dose of radiation, and that's very conformal around the tumor. So very little dose goes to, say, the extra lung tissue or your heart or anywhere else. And so we're able to literally ablate that tumor. No incision, no cuts, almost essentially no side effects to the patient, and we cure their cancer just with 5 treatments, and that's called stereotactic body radiation therapy. Amazing technology that we have here.
And what does it mean that you guys take a multidisciplinary approach?
Sure. I mean, so you just can't, just one specialty can't treat cancer anymore. Mm-hmm. Cancer is it's a disease that needs multiple input from multiple physicians. And so when we talk about this multidisciplinary approach, what we do from the beginning of when we first diagnose this patient, we have a tumor board where all the physicians are in one room and we talk about that patient's case. And so the radiation oncologist is there, the medical oncologist, the chemotherapy doctor is there, the surgeon is there, the research folks are there, the nurse navigators are there, the social workers are there. So we have this whole team approach, because it's not just to treat the cancer, but it's to treat the patient too, emotionally and that sort of thing. And so we literally, each specialty has their input on that patient's treatment plan, so we can literally come up with the best treatment plan that's going to give the best outcome for that patient. So it's just not one doctor deciding your treatment, it's a team approach.
That makes sense. And you mentioned, of course, the research, and you guys have been working for, 18 years with Johns Hopkins on that effort, and you're able to do clinical trials here, right?
Correct. And we actually have a very robust research department here. Mm-hmm. That is, we have the collaboration with Johns Hopkins too, but we also have some in-house trials that we're able to enroll patients on to try to get the latest and greatest out there. So we're constantly trying to improve our cancer care and our outcomes. And the only way we can do that is by testing new drugs or new therapies or new radiation techniques. And so we have to enroll these patients on these trials to see if is this new experimental treatment better than the standard of care? And the only way you can do that is trials. And so, interesting, the research has shown that patients that are on clinical trials do better than patients that are not on clinical trials. So you actually can potentially have a superior outcome by just enrolling on a trial. So not only are you going to collect information and help us improve cancer care for future generations, you're probably doing yourself a favor by entering on the clinical trial. And so we have a really great department here that is really doing a great job of trying to enroll as many patients as we can. And I really invite any patients out there that might be hearing this is really consider clinical trials in the future, because it's in your best favor.
Absolutely. So you invite that for patients, and of course you invite everybody to do routine cancer screening, right?
Yeah, and that's a big thing during COVID. Screening literally stopped overnight, and I really have definitely seen patients that are coming in now with much more advanced cancers because they were not able to get their screening, like their colonoscopies or their mammograms, or to get their PSA test, or for women to have a pap smear, that sort of thing. And so finally that's sort of opened up now, and so I really encourage everybody out there to restart their screening, because there's a lot of patients that may be 2 or 3 years out from having their last mammogram because they literally couldn't get it because there was a backlog too. So it's so important to have that annual screening because if we catch the cancer early, we can cure you very easily. If we catch it very late, we may not be able to cure you. And that's the whole point of screening, is to catch cancers at a very early stage. They're very curable. And so I really want to get the word out there, is to get your screenings as scheduled, and you can discuss it with your primary care provider. They can schedule out for that.
I'm so thankful for your passion for what you do. Have you always been really passionate about this?
Absolutely. I have the best job in the world. As a radiation oncologist, I get to treat cancer patients, and that is, honest, in my opinion, the best group of patients to treat out there because they get it. You know, they're not going to sweat the small stuff anymore. This big thing that's changed your life called cancer has come on board. And so as a team between the patient and I, it's just such a joy to treat them. It's really a very uplifting specialty, believe it or not. People say, oh, it must be hard to be a cancer doctor. No, it's just the opposite. It's the greatest job in the world.
Well, I'm so thankful for what you do. And again, you are the medical director of the Richard A. Henson Cancer Institute at what locations?
So we actually have 3 locations. We have one in Salisbury at the hospital. We also have a cancer center that has both medical oncology and radiation oncology in Ocean Pines, so it's a full-service cancer center. And then Allen Cancer Center just joined us in Seaford, and so that's under our umbrella now. That's part of TidalHealth. So once again, a fantastic cancer center with both medical oncology and radiation oncology co-located in the same location. So I'm the medical director for all 3 sites.
All right, awesome. And of course, you are also the radiation oncologist, Dr. John Mansuetti.
Yep.
Thank you
Katie.
so much.
Appreciate it.